Walking through Body Interact, you see three main menus: Home, Training Center, and Settings. In your Patients, there's your current list of cases, which you can easily filter to find a specific patient. To get started with a simulation, just pick a scenario, adjust the time, and click Start. In the simulation, you'll feel like in a real emergency room, and you're in charge of managing this patient. Take a closer look at the face or legs by adjusting the view options here. So, what can you do? Dialogue with the patient to understand what happened and take the clinical history.
I'm feeling weak.
Physical examination. Following the ABCDE assessment, you may check the airways, auscultate the lungs, observe the pupillary light reflex, and much more. The vital signs can be turned on under monitoring, and the values will adapt in real time according to the patient's conditions. A wide range of tests can be requested, like imaging tests, ECGs, lab tests, and more. To remove tests from the screen, just drag them out or use the bin button. Tests can be reviewed anytime on the medical records folder. Use the call option to ask for a specialist's opinion or to send the patient to another department. There are many interventions and procedures you can do, like inserting a catheter, giving oxygen, doing life support, and much more. For medications, a wide range of options is available. In basic cases, you just have to choose the category, while in intermediate and advanced, you need to select the drug, mode, and doses. How does a case end? A success message will appear if your practice meets the guidelines requirements. However, you can jump into the feedback section anytime before the case ends. After a case, choose the most likely differential diagnosis. The feedback part provides detailed reports to understand how well you have done. The timeline summarizes all the actions taken in time order. The performance shows what you have done correctly, incorrectly, and what was missing. And the knowledge lists the clinical competencies developed in that scenario. Last but not least, the take-home message shows if you were successful, the learning objectives, and the scientific references behind that case. Thank you for watching.